Hello, my name is Frank Nikova, and I guess I'd like to describe myself as a BPH survivor. About 8 or 10 years ago, I started suffering some of the effects of a BPH. It wasn't bad, but my doctor, primary care doctor, gave me some medication to help me relieve myself, which was okay for a few years. But over the last few years, it started getting worse. And about the last year, I was really struggling with the problem, so I went to see my urologist. And he said, well, we got some procedures we can use if we have to. Well, as things turned out, about 4 months ago, I had a total blockage. It was bad. It was in the evening, on a weekend. I rushed to the emergency room. They cathetered me and relieved the pressure. Went to see my urologist first thing Monday. Called him up. He prescribed some Flomax, which he said will help me. But he said keep the catheter until we can test you. I said, well, this is pretty bad, but I will. Well, the Flomax did help. Anyway, in a couple of days, I went to see my urologist. And he ran a bunch of tests on me and said, here are the options. Because of the size of your prostate, we're going to have to, it limits our options. And so he said, maybe we should do this procedure called a PAE procedure, where they go in and block the artery to your prostate. And he said, I've got the best doctor in the US to do this for you, Dr. Bagla. Met with Dr. Bagla, and he went through the whole, explained how the procedure works, and he was one of the pioneers, by the way, of this for this procedure in the U.S. And he's been doing it for about 10 years, so I felt extremely comfortable under his care. So then I scheduled the procedure, came in, had it done. It was very quick, simple, painless, about an hour. It was non-invasive because they went through your artery right into the prostate to block the blood flow, the arterial flow into the prostate. Boy, I tell you, started the second week, things started improving, and now I'm about, 8 weeks post-procedure, and I'm really doing fine. It's like night and day. It turned my life around. No more problems. My quality of life has improved 100%. Well, I tell you, I couldn't have been treated better by the staff, from the admin staff to the nurses to the aides. Everyone was made me feel very comfortable. They're very caring, and I couldn't have asked for a better treatment as a patient. Outstanding people. Well, I don't have to run to the bathroom as often anymore. And when I do go, it's a nice flow. I don't struggle. And especially at night, I used to get up several times a night and really struggle to relieve myself. But I was really suffering over the last, I would say, 6 or 8 months. It was really bad. So like I said, this procedure just improved my quality of life tremendously. Well, for one thing, like I said, it's outstanding people here, outstanding doctor, no complaints at all. But more importantly, it's a non-invasive procedure. All of the other procedures that were explained to me, you can imagine going up your urethra with instruments and trying to get to that prostate. That didn't sound like a lot of fun to me. And with the PAE, it's totally pain-free, and then they sedate you. So you're not totally out, but you're feeling very comfortable. You can hear what's going on, and before you know it's all over with, absolutely no pain to the procedure at all. You need to see Dr. Bagla. I said, okay, if you say so, I trust you. Excellent company, excellent treatment. You cannot go wrong putting yourself under their care. Outstanding. Prostate, artery, embolization. That's the procedure, PAE.